In the previous submodule, we introduced the chronic disease continuum in terms of upstream, midstream, and downstream. As a CNA, you will most often encounter patients with the midstream and downstream segments of the continuum. However, it's important to understand your scope of practice while working with these patients. CNAs are part of a healthcare team and assist other healthcare workers by working directly with patients. Each person in the healthcare team has a role in the patient's care. The physician is responsible for diagnosis, treatment plans, and prescribing medications. The registered nurse is responsible for administering the treatment plan, tracking progress, and providing ongoing care. This may include assessing and monitoring progress, medication management, and patient education about their condition and preventative care. CNAs are responsible for a patient's activities of daily living. These include basic tasks such as bathing, grooming, toileting, eating, and moving. CNAs may be asked to check vital signs, record and report data into electronic medical records, and communicate the patient's needs to the other healthcare team members. As a CNA, your scope of practice may vary by the state in which you work. In this lesson, we will cover some of the common chronic diseases that are affecting CNA patient populations. For each condition, we will introduce terminology, risk factors, complications, treatment, and your scope of practice. Let's start with diabetes. The key distinction between type 1 and type 2 diabetes lies in their underlying causes, age of onset, insulin dependence, and treatment approaches. Type 1 diabetes is an autoimmune condition requiring insulin from the start, while type 2 diabetes is characterized by insulin resistance and may initially be managed through lifestyle changes and oral medications. It's important for individuals with either type of diabetes to work closely with healthcare professionals to develop a comprehensive management plan tailored to their specific needs. Screening for diabetes typically involves measuring fasting blood glucose levels and hemoglobin A1C glycated hemoglobin levels. These tests help diagnose and monitor diabetes and its management. Here's an overview of both tests. The fasting blood glucose test measures the level of glucose, sugar, in your blood after an overnight fast, usually 8 hours. This test provides information about your blood sugar levels at a single point in time. Normal range. A normal fasting blood glucose level is usually below 100 milligrams per deciliter. Prediabetes. Fasting blood glucose levels between 100 to 125 milligrams per deciliter indicate prediabetes. Diabetes. Fasting blood glucose levels of 126 milligrams per deciliter or higher on 2 separate occasions suggest diabetes. The hemoglobin A1C test measures the average blood glucose levels over the past 2 to 3 months. It provides a longer-term perspective on blood sugar control and is not affected by short-term fluctuations. Normal range. A normal A1C level is usually below 5.7%. Prediabetes. An A1C level between 5.7% and 6.4% indicates prediabetes. Diabetes. An A1C level of 6.5% or higher on 2 separate tests suggests diabetes. Diabetes can lead to a variety of complications if not properly managed. The complications can affect various organs and systems in the body. It's important to control blood sugar levels through lifestyle changes, medication, and regular medical checkups to reduce the risk of these complications. Here are some common diabetes-related complications. 1. Cardiovascular complications. Heart disease. Diabetes increases the risk of coronary artery disease, heart attacks, and other heart-related issues. Stroke. Diabetes raises the risk of stroke by contributing to the buildup of fatty deposits in blood vessels. 2. Kidney complications. Diabetic nephropathy. Diabetes can damage the kidney's filtering system, leading to kidney disease, and in severe cases, kidney failure. 3. Eye complications. Diabetic retinopathy. High blood sugar levels can damage the blood vessels in the retina, leading to diabetic retinopathy and potential vision loss. 4. Nerve damage. Diabetic neuropathy. Diabetes can cause nerve damage, leading to numbness, tingling, pain, or weakness, typically in the hands and feet. 5. Foot complications. Nerve damage and poor circulation can lead to foot problems, infections, and even ulcers that may not heal properly, potentially leading to amputation. 6. Skin complications. People with diabetes are more prone to skin infections, fungal infections, and slow wound healing. 7. Cognitive issues. There is some evidence linking diabetes to cognitive decline and an increased risk of dementia. 8. Gastroparesis. This condition affects the stomach's ability to empty properly, leading to nausea, vomiting, and digestive problems. Some roles may differ according to your state regulations, but in general, CNAs will assist diabetics by 1. Monitoring vital signs. CNAs often measure and record vital signs such as blood pressure, pulse, respiratory rate, and temperature. These measurements can provide valuable information about a diabetic patient's overall health. 2. Blood glucose monitoring. CNAs may assist diabetic patients with blood glucose monitoring, including performing finger stick tests, recording blood sugar levels, and reporting abnormal results to the nursing or medical staff. 3. Assisting with insulin administration. Depending on the state's regulations and facility policies, CNAs may assist with insulin injections or insulin delivery using insulin pens or pumps under the supervision of a licensed nurse. 4. Meal assistance. CNAs may help diabetic patients with meal planning, preparation, and feeding, ensuring that dietary recommendations are followed to help manage blood sugar levels. 5. Mobility and activities. CNAs support patients in their daily activities, helping them maintain their mobility and encouraging regular physical activity, which is important for diabetes management. 6. Skin care. Diabetic patients are at an increased risk of skin issues. CNAs can assist with proper skin care, including checking for skin problems, helping with hygiene, and reporting any changes to the nursing staff. 7. Monitoring fluid intake. CNAs may track a patient's fluid intake and output, as hydration is important for managing blood sugar levels. 8. Documenting. Accurate and thorough documentation of the patient's condition, blood sugar levels, and any changes in their health is essential for effective communication among the healthcare team. As a certified nursing assistant, CNA, you may be involved in providing acute care for diabetic patients under the supervision of a licensed nurse or healthcare professional. Here are some important steps to follow when assisting with diabetes care in an acute setting. 1. Monitoring vital signs. Regularly measure the patient's vital signs, including blood pressure, heart rate, respiratory rate, and temperature. 2. Blood glucose monitoring. Perform blood glucose monitoring as instructed by the nurse or healthcare provider. Use proper infection control measures and follow the facility's protocols. 3. Administering medications. Assist with administering insulin or oral diabetes medications according to the nurse's instructions and the patient's care plan. Ensure accurate dosage and timing, and document the administration appropriately. 4. Nutrition and hydration. Help patients follow their prescribed meal plans, ensuring that they receive balanced meals at appropriate times. Offer water to keep patients hydrated. 5. Recognizing symptoms. Be vigilant in observing and reporting any signs of hyperglycemia or hypoglycemia, such as confusion, weakness, sweating, dizziness, or changes in behavior. 6. Emergency response. In the event of diabetes emergencies, such as severe hyperglycemia or hypoglycemia, follow the facility's policies and protocols. If blood sugar levels are dangerously high or low, inform the nurse or healthcare provider immediately. 7. Documenting care. Maintain accurate and timely documentation of blood glucose readings, medications administered, meals consumed, and any relevant observations. Let's move on to hypertension. Hypertension, commonly referred to as high blood pressure, is a chronic medical condition characterized by consistently elevated blood pressure levels in the arteries. In order to understand the pathophysiology of blood pressure, we need to be familiar with a few terms. Blood pressure refers to the pressure on the vascular system, which is composed of veins, arteries, and capillaries. Systolic blood pressure is the number on the top of a blood pressure reading. It refers to the pressure on the arteries when the heart pumps blood. Diastolic blood pressure is the number at the bottom of the blood pressure reading, and it refers to the pressure on arteries when the heart is resting. When looking at a blood pressure reading, it's important to know what is in the range of healthy, elevated, and when the diagnosis is a concerning level, such as stage 1, 2, or 3 of hypertension. Blood pressure is measured in millimeters of mercury, mmHg, and is represented by two numbers: systolic pressure, the higher number, and diastolic pressure, the lower number. Normal levels are a systolic blood pressure level less than 120 and diastolic level less than 80 millimeters of mercury. Elevated levels are when systolic blood pressure is between 120 and 129 and diastolic blood pressure is still less than 80. As you will notice, once pre-hypertension levels begin, we see a rise in the diastolic from 80 to 89. Why is this important? Well, now the heart is working hard even when it is at rest. This becomes concerning, as increased load on the heart may eventually lead to heart failure over time. So we can see that each interval of stage 1, 2, and 3 get progressively higher in both systolic and diastolic blood pressure. Untreated or poorly controlled hypertension can lead to several serious complications, including cardiovascular disease. Hypertension is a major risk factor for heart disease, heart attacks, and strokes. Kidney damage. Chronic high blood pressure can damage the kidneys and lead to kidney failure. Eye damage. Hypertension can damage the blood vessels in the eyes, leading to vision problems or even blindness. Aneurysms. Persistent high blood pressure can weaken blood vessel walls, potentially leading to the formation of aneurysms, weakened and bulging areas in blood vessels. Peripheral artery disease. Hypertension can contribute to reduced blood flow to the legs and feet, causing pain and poor wound healing. Cognitive decline. Chronic hypertension may increase the risk of cognitive decline and dementia. The role of a certified nursing assistant, CNA, in hypertension care may include vital sign monitoring. CNAs often measure and record blood pressure as part of routine patient care. Documenting observations. CNAs document changes in vital signs, including blood pressure readings, for the healthcare team's review. Assistance with activities of daily living. CNAs help patients maintain a healthy lifestyle by assisting with activities such as mobility, hygiene, and meal preparation. Supporting medication management. CNAs may help remind patients to take their prescribed medications, although they typically do not administer medications themselves. Reporting changes. CNAs inform licensed nurses or other healthcare professionals if they notice significant changes in a patient's condition, including blood pressure fluctuations. Acute care for hypertension involves addressing sudden, severe spikes in blood pressure that can pose immediate health risks, such as a stroke or heart attack. Here are the steps to follow when assisting with care for a patient in a hypertension emergency. 1. Recognize symptoms. Be alert to signs of a hypertensive emergency, such as severe headache, chest pain, shortness of breath, confusion, blurred vision, and neurological symptoms. 2. Monitor vital signs. Regularly check the patient's blood pressure as instructed by the nurse or healthcare provider. Record the patient's blood pressure accurately and report any significant changes immediately. 3. Assist with medications. Assist with administering prescribed antihypertensive medications as directed by the nurse or healthcare provider. Ensure accurate dosage, timing, and proper administration techniques. 4. Maintain calm environment. Keep the patient calm and encourage them to rest. Ensure the patient is in a comfortable position, usually sitting or lying down, with their head elevated. Be attentive to the patient's comfort and safety. ensuring they do not engage in any activities that could worsen their condition. 5. Emergency response. In case of a severe hypertension emergency, follow the facility's emergency protocols and notify the nurse or healthcare provider immediately. Administer oxygen if necessary and as instructed. Collaborate with the nursing team, doctors, and other healthcare professionals to ensure the patient's care plan is followed effectively. 6. Documenting care. Document the patient's blood pressure readings, medications administered, and any other observations accurately and promptly. 7. Patient education. Provide basic education to patients about hypertension management, including the importance of taking prescribed medications, monitoring blood pressure, and making lifestyle modifications. 8. Follow-up care. Assist with any necessary follow-up tests, appointments, or interventions as directed by the nurse or healthcare provider. Cardiovascular disease refers to a group of conditions that affect the heart and blood vessels. Complications of cardiovascular disease can vary based on the specific condition, but they commonly include heart attack, myocardial infarction. This occurs when blood flow to a part of the heart muscle is blocked, causing damage to the heart tissue. Stroke results from the interruption of blood flow to the brain, leading to brain damage and various neurological deficits. Heart failure happens when the heart cannot pump blood effectively, leading to symptoms like shortness of breath and fatigue. Arrhythmias, irregular heart rhythms that can disrupt normal blood flow and lead to various symptoms. Peripheral artery disease, reduced blood flow to the extremities, causing pain and potential tissue damage. The scope of practice for a CNA when caring for someone who has had a cardiovascular event, such as a heart attack or stroke, includes a range of supportive and essential tasks. While the specifics can vary depending on your state's regulations and the facility's policies, here are some general responsibilities you might have. 1. Activities of daily living. 2. Vital signs and monitoring. 3. Mobility and positioning. Help patients move and change positions to prevent complications like pressure ulcers or muscle stiffness. Follow guidelines to ensure safe patient transfers. Assist with gentle range of motion exercises to prevent stiffness and promote circulation. 4. Emotional support. Provide emotional support and reassurance to the patient and their family. Listen to their concerns and help alleviate anxiety. 5. Assisting with meals. Assist patients with eating and drinking as needed. Ensure they follow any dietary restrictions as advised by healthcare professionals. 6. Observation and reporting. Watch for any signs of distress or complications related to the cardiovascular event. Report changes promptly to the nursing team. Accurately document all care provided, vital signs, and any observations made. Maintain organized and detailed records. 7. Comfort and safety. Ensure the patient's comfort and safety by keeping their environment clean and clutter-free. Prevent falls and other potential hazards. 8. Collaborating with the nursing team. Work in collaboration with licensed nurses and other healthcare professionals to ensure the patient's care plan is followed. Communicate any concerns or changes in the patient's condition to the appropriate staff. In the event of an emergency cardiovascular event, timing is crucial. Observe and document any sudden changes in the patient's behavior, movement, or speech. Stay calm and seek assistance from the nursing team immediately. Provide emotional support to the patient. Ensure the patient's safety and comfort, and prevent falls or other injuries. Follow the facility's emergency protocols as instructed. COPD is a progressive lung disease characterized by persistent respiratory symptoms and airflow limitation. The two primary conditions under the COPD umbrella are chronic bronchitis and emphysema. Chronic bronchitis involves inflammation and narrowing of the airways, while emphysema involves damage to the air sacs in the lungs, leading to reduced lung function and breathing difficulties. Complications of COPD can include shortness of breath and difficulty breathing, frequent respiratory infections, decreased lung function and exercise tolerance, reduced quality of life due to limitations in daily activities, respiratory failure, where the lungs can't provide adequate oxygen and remove carbon dioxide, increased risk of heart problems such as heart failure and heart attacks, anxiety and depression due to the impact on daily life. In the acute care setting, your role as a CNA in COPD care involves assisting with activities of daily living, such as bathing, dressing, and grooming, monitoring and documenting vital signs, including oxygen saturation levels, helping with patient mobility and positioning to support breathing and prevent complications, providing emotional support to COPD patients and their families, assisting with oxygen therapy devices as directed by the nursing team, collaborating with licensed nurses to report any changes in the patient's condition. When providing acute care to patients with chronic obstructive pulmonary disease, COPD, as a certified nursing assistant, CNA, your primary focus is to support the patient's comfort, monitor their condition, and ensure a safe environment. Assistance with activities of daily living, ADLs. Help patients with COPD manage their daily activities, such as bathing, dressing, grooming, and toileting. Energy conservation techniques can be taught to help patients minimize exertion and manage shortness of breath. Encourage deep breathing and coughing exercises. Remind patients to perform prescribed deep breathing and coughing exercises to maintain lung function and prevent respiratory complications. Positioning. Help patients find comfortable positions that ease breathing, such as using pillows to prop them up slightly in bed. Mobility support. Assist patients with mobility and transfers while taking care to avoid overexertion that could worsen breathing difficulties. Maintain a safe environment. Ensure that the patient's immediate surroundings are clear of obstacles that could cause falls or accidents, as patients with COPD might have decreased mobility and balance. Arthritis refers to a group of disorders characterized by inflammation and pain in one or more joints. It is a chronic condition that can affect people of all ages and can lead to joint stiffness, decreased mobility, and overall reduced quality of life. There are numerous types of arthritis, each with its own causes, symptoms, and treatment approaches. Types of arthritis. 1. Osteoarthritis, OA. This is the most common form of arthritis, often associated with aging and wear and tear on joints. It occurs when the protective cartilage that cushions the ends of bones wears down over time. 2. Rheumatoid arthritis, RA. RA is an autoimmune disorder in which the immune system mistakenly attacks the synovium, the lining of the membranes that surround joints. This leads to inflammation, pain, and joint damage. 3. Psoriatic arthritis. This type of arthritis occurs in some people with psoriasis, a skin condition. It affects both the skin and joints, causing pain, stiffness, and inflammation. 4. Ankylosing spondylitis. This primarily affects the spine, causing inflammation in the vertebrae that can lead to fusion of the spine and limited mobility. 5. Gout. Gout is caused by the buildup of uric acid crystals in the joints, leading to sudden and severe pain, swelling, and redness. 6. Lupus. Systemic lupus erythematosus, SLE, is an autoimmune disease that can affect multiple organs, including the joints. Joint pain and inflammation are common symptoms. Arthritis can lead to varying degrees of disability, depending on the type and severity of the condition. Complications can include joint deformities, limited mobility, and difficulties with daily activities. In some cases, arthritis can also affect organs other than the joints. 1. Joint deformities. Over time, certain types of arthritis, such as rheumatoid arthritis, RA, can lead to joint deformities. Inflammation and damage to the joint structures can cause joints to become misaligned or lose their normal shape. 2. Limited mobility. As arthritis progresses, joint stiffness and pain can lead to limited range of motion, making it difficult for individuals to move joints freely. This can significantly impact their ability to perform daily activities. 3. Chronic pain. Chronic pain is a hallmark of arthritis. It can affect not only the joints, but also the surrounding tissues and muscles. Persistent pain can have a significant impact on a person's quality of life and mental well-being. 4. Osteoporosis. Some types of arthritis, particularly those that involve chronic inflammation, can increase the risk of osteoporosis, weak and brittle bones that are more prone to fractures. 5. Infections. Inflammatory arthritis conditions, as well as the use of immunosuppressive medications, can weaken the immune system and increase the risk of infections. 6. Eye complications. Certain types of arthritis, such as ankylosing spondylitis and rheumatoid arthritis, can affect the eyes, leading to issues like uveitis, inflammation of the eye's middle layer. 7. Cardiovascular issues. Rheumatoid arthritis and other inflammatory types of arthritis are associated with an increased risk of cardiovascular diseases due to systemic inflammation. CNAs play a crucial role in supporting arthritic patients by assisting with activities of daily living, monitoring patients' conditions, and providing emotional support. Their scope of practice generally includes 1. Assisting with mobility. CNAs help patients move around, providing gentle support during transfers, walking, and exercises to maintain joint flexibility. 2. Personal care. CNAs assist with bathing, dressing, grooming, and toileting, adapting techniques to accommodate joint pain and limitations. 3. Medication support. CNAs can remind patients to take their prescribed medications and report any side effects or concerns to higher-level medical staff. 4. Emotional support. CNAs provide a listening ear and emotional support, as living with chronic pain can take a toll on a patient's mental and emotional well-being. 5. Basic first aid. CNAs might assist in applying hot or cold packs to joints, as directed by medical staff, to help manage pain and inflammation. 6. Monitoring. CNAs observe and report changes in patients' condition, such as increased pain, swelling, or difficulties with mobility, to nurses or doctors. In the event of an emergency arthritis event, timing is crucial. Observe and document any sudden changes in the patient's behavior, movement, or speech. Stay calm and seek assistance from the nursing team immediately. Provide emotional support to the patient. Ensure the patient's safety and comfort, and prevent falls or other injuries. Follow the facility's emergency protocols as instructed. CNAs are essential members of the healthcare team who offer direct care to patients with chronic diseases, helping them maintain their well-being and quality of life. CNAs are not authorized to perform medical procedures, diagnose conditions, or administer medications except under specific circumstances and supervision. Their role is to support patients' comfort and well-being, maintain a safe environment, and assure open communication among patients, families, and medical professionals.